Hi, friends. Once again, this is Dr. Michael Johnson. Obviously, I'm wearing this mask not for disguise, but for the sake of personal protection. We don't have adequate supplies of these, so a friend gave these to me. So I really appreciate her looking out for me and, of course, my family. Um, I've not been tested for coronavirus yet. Again, testing is not widely available. But I wanted to talk to you about testing. Um, that is, if you have been tested and you are negative, that is good news. It's not readily available to most people. But even if you test negative, I want to tell you that should not change how you behave. Okay, let me say that again. If you test negative for coronavirus, it shouldn't change how you behave. Why? Number one, negative testing could mean that you are truly negative, or it could mean that you are infected and the virus is undetectable, that it is a low level of virus. It could be that the testing was done improperly, or that the reagent that they use was, how do we put it, not properly stored and not properly utilized. So a negative test, though it is good news, should not change how you behave. There is such a thing as a false negative. We even see it in influenza. False negative means that you can still spread the disease. That's number two. So if you're negative, you could be truly negative or false negative, and that means you can still spread the disease. Or it can mean, number three, that you're truly actually negative, but you are still at risk for becoming infected by someone who is positive and not detected. All right, so testing negative is good news, but it should not change how you should behave. So, with that in mind, well, who should get tested then? I mean, what's the sense of going through this? I'm glad you asked that question. Who should get tested? Anyone who is at high risk of complications: asthmatics, COPD, chronic obstructive pulmonary disease, heart disease, chemotherapy, the immunosuppressed, the transplant people, the kidney dialysis, those who are diabetic, those should be tested. Anyone who's over 60 years of age should be tested because they're at greatest risk for major complications. Anyone who has symptoms of a viral illness, fever, chills, cough, sore throat, that does not respond to the common over-the-counter medications. That includes cough suppressants, ibuprofen, Tylenol, and similar medications. Fourth, those who are directly involved in patient care. They should be tested. You should be tested. And those involved who are caring for somebody who's infirm. You may be taking care of an elderly parent or relative, or you should be tested. If you meet those categories, you should be tested. If not, if you don't meet those categories, just relax. Monitor yourself for symptoms. Remain calm. Keep your social distancing as advised by local health authorities. And most importantly, for accurate and timely information, avoid Facebook. Please. Avoid the social media industries. So avoid the search of all of these so-called experts and rumors. If you want to get really reliable information, go to the websites of the CDC, the Centers for Disease Control, the NIH, the National Institutes of Health, and the WHO, the World Health Organization, and any of your state and local medical authority websites. Go to those. So if you want to be be truly informed, properly informed, stay safe, pray, as I said, wash your hands at least 30 seconds with soap and water. If those are not available, use a hand sanitizer. Clean surfaces frequently. Those that are frequently touched, clean them with soap and water, diluted bleach detergents. Cough or sneeze into a flexed forearm. Avoid public spaces and exposure in public places. Wear a mask, as I'm doing. Pray and wash your hands. Get tested if you meet those criteria that I've outlined. Otherwise, wait. Wait, and be safe. Hosea 4:6 says, "My people are destroyed for lack of knowledge." I hope this is knowledgeable for you. Share this knowledge. Be safe. Pray and wash your hands. God bless.